Nikita is a seasoned athlete. She's a javelin thrower, presently selected for the national camp. She says she occasionally develops pain and discomfort on the back of the shoulder. As a coach, trainer, or a therapist, you try to check and compare the range of motion of both shoulders. You find that there is difference in the range of motion and slightly restricted shoulder movement in the throwing arm. What flexibility stretching exercise can aid in preventing injuries in this shoulder in this particular athlete? If you're looking for answers to these questions, you're in the right place. Welcome to the course on Physical Medicine and Rehabilitation in Sports offered by NPTEL. And we are covering week 6 on flexibility and mobility. And today's lecture is on types of stretching and their effects on injury prevention. You are with me, Wing Commander Chandrasekhar Guru. I'm a sports medicine specialist from the Armed Forces Medical College. The learning objectives of this lecture would be mainly focusing on the stretching exercises, understand the physiological basis of stretching, what are the types of stretching exercise, how you can apply it in your routine day-to-day practice in sports, and what are the practical aspects in terms of sport specific scenarios that we will be discussing. So what is stretching in sports? Stretching is nothing but lengthening of the soft tissues to improve flexibility and range of motion. It involves muscle elongation and is crucial in maintaining optimal muscular skeletal function. Passive stretching would mean using external resistance to do that elongation. Active stretching is without any assistance, using the strength of only opposing muscles itself. What are the benefits of stretching? Stretching increases the flexibility, enhances the joint range of motion, reduces muscle stiffness, aids in injury prevention, and promotes circulation and recovery. We have studied about the basics of stretching in the previous lecture. Let's go a bit deeper in what is the physiological basis of stretching. It is the neurological control. Muscle spindles are receptors that are present in the muscle to sense the muscle length. They are located in the intrafusal fibers amidst the force producing extrafusal fibers, and these are supplied, the extrafusal fibers are supplied by alpha motor neuron, and the muscle spindle are supplied by the gamma motor neuron. So when the muscle spindle senses the change in the length, it gets stimulated and sends excitatory signal which stimulates the alpha motor neuron. When the alpha motor neuron is stimulated, we know that it supplies group of muscles, so it immediately causes contraction, which is the basis of stretch reflex. As you use a knee hammer to strike on the patellar tendon, it immediately causes a stretch reflex wherein you have contraction of the quadriceps causing the leg to extend. So this particular stretch reflex is activated or kind of initiated through the muscle spindle, and since as such the alpha motor neuron is activated in addition to the gamma motor neuron. So both of this causes alpha gamma coactivation. This process is called alpha gamma coactivation, which results in increased force production. So simple increase in muscle length, which is in fast in nature, can cause increase in the force production. So this particular type of stretching is called as dynamic stretching, and this is the principle which is used in dynamic stretching and ballistic stretching techniques. There is also another group of organs, the sensors you call as Golgi tendon organ. These are mechanoreceptors which are located in the musculotendinous junction. So they are proximal to the tendon and they sense the tension which is produced by the muscle. So when the GTO is kind of activated, it kind of sends inhibitory signals and inhibits the alpha motor neuron, and inhibition of alpha motor neuron results in relaxation of that particular muscle. So that is called as an inverse stretch reflex, wherein stretch reflex causes an excitation and increase the force production. Inverse stretch reflex causes inhibition and results in relaxation of the muscle. When the relaxation of the same muscle happens, it is called as autogenic inhibition, and if the relaxation of the antagonist muscle or the muscle which opposes this particular action uh, is inhibited, it causes reciprocal inhibition. This is the kind of principle which is used in static type of stretching and PNF stretching techniques. So having known or learnt about the physiological basis of stretching, let's delve deeper into the different techniques of stretching. There are 4 different techniques, starting with static stretching, dynamic stretching, ballistic stretching, and proprioceptive neuromuscular facilitation stretching. So let's see what is static stretching. It's a form of static flexibility wherein a sustained slow stretch held at the end range of motion causes kind of relaxation by activating the GTO. The duration of the hold that needs to be maintained is minimum of 15 to 30 seconds to have a desired improvement in terms of relaxation and subsequent elongation of the connective tissues. So, the activation of GTO causes an inverse stretch reflex which results in relaxation of the stretched muscle, and this subsequently causes an increase in the range of motion. Important advantage of this type of stretching is that it is easier to learn, and it doesn't require a partner. So example would be, sitting and with the knee extended and trying to touch the toe using your hands or closer to the ankle or the lower leg. So that is called as a simple static stretching, where you are trying to stretch the hamstring and the calf muscles. Caution about static stretching is that static stretching, as we said, results in relaxation. So hence it cannot be planned or cannot be timed in a pre-workout session. So when you use it as a pre-workout modality, it causes relaxation and may kind of hamper the force production. So that may kind of decreases the force production and result in performance decrement. So it has to be timed always after the activity. So the application of it is that it is used in cool down routines. It's kind of used in injury prevention programs, since it causes relaxation. Using multiple large group as a one particular session can also help in kind of recovery, and it is also used for long term flexibility gains. Coming over to the ballistic stretching. Ballistic stretching is a form of dynamic flexibility wherein a bouncing type of movement is involved. So this is kind of to stimulate a stretch reflex. So it is not necessary that you should go towards the end range of position, unlike the static stretch where you need to go to the end range of motion. Here it is as per the requirement of the particular sports. So the basic idea of using a ballistic stretching is just to elucidate a stretch reflex, so that it helps in kind of improving the performance. So it increases the force production. So the range of motion may be limited. So that is as per the requirement of the motor execution. Example would be kind of using in jump sports. Say for example a basketball player or a high jumper or a long jumper can you generally they use skipping or jumping jacks as form of pre activity routine or in a warm up protocol, so that causes increase in the force production during the actual activity. So that is the ballistic type of stretching. Caution is that they should be sequenced properly after a good amount of general warm up, so that since it involves ballistic stretching, there may be chances that it may end up in causing an injury. So it is important to have a general warm up first before going into a specific ballistic type of stretching in specific warm up, and then also to gradually increase the intensity of the activity that is included in that particular stretch routine. So the application in athletic performance would be, it is used in the warm up routine, specifically in the later part of warm up or the specific warm up kind of routines. It is injury prone and it has to be monitored. It is however found to improve the performance in increased power production as well as the force production. So here the flexibility gain in terms of dynamic flexibility is good. The third type of stretching technique is the dynamic stretching technique. Dynamic stretching technique involves mobility drills. It is a lower level of intensive drills compared to the ballistic. So ballistic is main focus is on improving the force production, whereas in dynamic stretching the main focus is on to motor control and kind of facilitating the neuromuscular loop, so that the end result is that they are already in a pre-activated state, so that when the actual activity or the movement is done, it is better. So it is generally used in the general warm-up routine, can also be used as the initial part of the specific warm-up routines as well. The basic physiological principle is that it activates the muscle spindle, thereby helps in increase force production. The movement is more important, given more importance as compared to the stretching component in this kind of stretching technique. The controlled movement helps in decreasing the injury, wherein the ballistic type of stretching, they are injury prone because of the ballistic nature bonding type of activity, whereas in dynamic stretching it is more of a movement control and helps in kind of neuromuscular facilitation. And this is a kind of a technical drill which is used in the general warm-up activity. It is commonly practiced in track and field athletes, say using hip mobilities and leg swings, commonly called as the ABCs, before the running and the track and field activities. The application in athletic performance, as we had discussed, the dynamic stretching is used in general warm-up and earlier part of the specific warm-up routine. It improves the dynamic range of motion, it is less injury prone, and it is also found to improve the neuromuscular coordination. Coming to the last type of stretching technique is the PNF stretching technique. PNF stretching technique is actually adopted from the neuro rehabilitation, generally in the individual with stroke or individual with increased stiffness or spasticity. Their PNF kind of stretching had a very good role, and from the clinical role it has been kind of adapted into the sports aspect as well. It is a combination of stretch followed by a contraction of the muscle. So the principle involved here is very simple, wherein because of the involvement of a stretch or increasing in the length, using a static kind of a stretch initially results in increase in the range of motion. Also, with the contraction involved during the process in the second step, it also helps in increased in the better flexibility outcomes and the range of motion outcomes. So, however, the demerit, or I would say a requirement in PNF stretching, is that you need a partner, and the partner should be kind of well aware about the various aspects of PNF stretching. So certain amount of expertise is required, so which is again considered as a drawback. The principle is that it uses the inverse stretch reflex by kind of triggering the Golgi tendon organ, and that may cause either a autogenic kind of inhibition or a reciprocal kind of inhibition, depending on the technique that is used. There are three different techniques which are employed in PNF method. The simpler one is the hold relax technique. The second one is the contract relax technique, and the third one is the hold relax with agonist contraction. So, to explain it in simple terms, hold relax would be all three techniques starts with the first step being a pre-stretch, that is you stretch the joint to the maximum limit possible. Thereafter, the partner holds that particular level at the end range of motion, similar to a static hold. Once that is achieved, then the partner advises the individual to contract in the same position and resist that particular contraction. So that becomes an isometric hold. So that means the isometric hold. So that is held for about 6 to 10 seconds, and thereafter the athlete or the individual in whom it is being done relax the muscle. That is done. Further, the partner tries to extend that end range of motion which has been set initially. So now it would be seen that it further extends and reaches a new end range of motion. So in that position, it is again held for about 15 to 30 seconds. So that's how you're using the GTO response to create relaxation subsequently in the by increasing the force by isometric or a concentric action, and further again increasing the length of the muscle. So that's how it is more effective compared to a static stretching technique. What are the guidelines if you want to incorporate stretching in your athletic performance? The American College of Sports Science and the National Strength and Conditioning Association of the United States recommends that you should incorporate at least 2 to 3 sessions in a week of flexibility, and static stretches should be used in case if you want to increase the flexibility component, where it should be at least 15 to 16 seconds per stretch. The more the duration of the hold, the better is the relaxation and increase in the flexibility gain. What should be the timing of the stretching? So, timing of the stretching is very important, because with respect to the sports, as we discussed in the warm up, it is important during the general warm up to have dynamic stretching about 10 to 15 minutes, with emphasis more on the movement and the coordination aspect of it. And the specific warm up routine, you go into ballistic kind of stretching, 5 minutes to 10 minutes, wherein it should be properly framed, formulated in a sequence which is monitored by the coach or the therapist. Subsequently, in the cool down, you can include static stretches of various muscle groups. You can also use static stretch as well as pain of stretching in injury rehabilitation. So, depending on the range of motion desired, you can institute either of these particular group of stretches. In case of routine training programs also for high level of athletes at the national or the international level, wherein you have a proper annual training program, it is important to institute at least one or two sessions of recovery sessions as active rest. And in this during these sessions, you can use static stretching of multiple muscle groups as part of that. So, that can also help in kind of relaxation of the muscle as well as the mind. What is the relation with these stretching techniques with age and gender? As we know, with age, the flexibility decreases. So, it is important that we institute stretching techniques more often than not in the older adults and athletes. In young athletes, it is easier, they get adapted faster. It is important that it is included in the older individual. When we come to gender, females are generally found to be more flexible because of the hormonal differences which is there, estrogen and progesterone. So, it is also important to consider this fact in the sport specific ecosystem as well. So, depending on the type of sports, the stretching or the flexibility training has to be instituted optimally. So, the injury profile again may differ because of this differences in male and female in a particular sports per se, and males are found to have more muscle stiffness. So, you can include more of a flexibility training in male athletes. Let us come back to the case. Nikita is a seasoned athlete. She is a javelin thrower presently selected for the national camp, and she says occasionally she develops pain and discomfort on the back of shoulder. So, as a coach, trainer, therapist, you try to check and compare the range of motion of both shoulders, and you find that there is a difference in the range of motion and slightly restricted in the throwing arm. So, what kind of flexibility stretching exercise would you kind of prescribe in an attempt to prevent the injuries in this particular athlete? That was the initial question that we started this lecture with. So, my analysis is that this is a national level player, overhead throwing is involved. So, biomechanical effects in terms of sports, especially on the compensation that could happen, are the posterior shoulder structures becomes tight and stiff because of the excessive external rotation and overhead overarm action. The internal rotation is also deficient. Say, because of excessive external rotation, there is a reduction in the internal rotation as compared to the other arm. So, that is called as GARD, glenohumeral internal rotational deficit. That needs to be addressed, especially in overhead sports like all throwing sports, swimmers, basketball. So, these people, these athletes have to be looked in for the internal rotational deficits. Scapular dyskinesia is again a common problem that can happen because of the biomechanical compensation, because of the and maybe injuries also because of the frequent training aspects and number of hours involved in kind of training. There may be compensation as well as injuries also. So, previous injury also become an important factor that needs to be considered when you are kind of thinking of instituting a program in your injury prevention program in the routine training cycle. So, in this case, dynamic stretching during the warm up would be beneficial, kind of using shoulder mobility drills to kind of uh, increase the circulation and the neuromuscular facilitation, so that the individual is already, the muscles and the relevant neural loops are already prepped up before the individual goes in for the actual throwing activity. Ballistic stretching can be used in terms of using medicine ball throws or plyo throws with the partner, so that that helps in kind of a pre-session routine as a specific warm-up as well. And static stretches should be included in the cool down sessions, basically to stretch the posterior capsular and the posterior shoulder structures. And also PNF stretching sessions can be included if the individual has a previous history of say shoulder injury or any other previous rehabilitation history and all. So you can include PNF sessions also as part of your routine microcycle as well. To summarize, stretch and inverse stretch reflex are the physiological basis of these stretching techniques. Dynamic stretching is used in warm-up. Ballistic stretching is used in specific warm-up and kind of used in pre-session routine to improve the performance. Static stretching is generally used as part of cool-down routines and recovery and relaxation sessions. PNF stretching is generally used in sports rehabilitation to increase the range of motion and the muscle length. Age and gender consideration is very important, especially when you incorporate flexibility training in your routine sports programs. So, for those of you who are interested in further in-depth reading, these are the references. Thank you for joining. Jai Hind.